Frimley Integrated Care System covers communities in North East Hampshire and Farnham, East Berkshire and Surrey Heath. It's a partnership of local health and care organisations brought together through a new vision of care. That new vision puts the patient's needs at the centre of their care.
The real difference has been the integrated care decision making, which we do within a number of teams that we've set up.
The integrated care team is the holistic approach that's taken towards patients. So it's all joined up, whether it's a social issue, mental health issue, physical health issue, or social care issue, whatever's needed, the integrated care team is able to access and organise.
Okay, so let's move on to the next. We've had a referral from the GP today for a memory clinic assessment. GP's wanting the memory reviewed because the 81-year-old lady is presenting as more confused. Family say that she's struggling with her activities of daily living. Husband is having to perform the caring role, so there's a significant risk of carer burnout. Daughter does live locally, does support, but works full time, so can't help out as much as she'd like to. It does look like there's quite a few comorbidities and they don't seem to be but controlled. So can we have a look at her case and get a better understanding of what's going on?
Okay. Yeah, so from social services system, I can see that there's currently no package of care in place and this lady's not known to us previously.
Okay. And I can see on my health system that there is history of falls for this lady. It looks like
this multi-professional, multi-agency team meets to discuss every referral they receive. On this occasion, due to the identified needs, the team decide that the mental health practitioner and the occupational therapist would visit together.
It was a really good home visit actually, in terms of having both myself, the mental health practitioner, and Diane, the occupational therapist, going in. So we were able to actually look at the home situation and to look at the needs from more than one point of view actually. So we discovered quite a few things that probably needs some urgent follow-up with. I think from a mobility point of view, Diane's certainly going to have to look into getting some maybe rails in place and looking at some adaptations in terms of helping with mobility. From a physical health point of view, I certainly have some concerns with regards to the diabetic management, and in terms of how she's currently presenting. So I'm probably going to speak to the GP so we could get some sort of feedback and sort of get the GP to do certain things to look into that. So her husband was actually also there, and I think what we didn't know was that he had some concerns and he has certain needs in his own right, which we're probably going to look into as well actually. So Diane's going to follow up with an assessment to do with him and in terms of his mobility.
Hello, this is Dr. Harrison speaking.
Hello, good morning, Dr. Harrison.
And it's Guru, the mental health practitioner with the integrated care.
I think integrated care has been a really progressive, positive way of working and a change of working for us. I think the other really beneficial thing for me of having an integrated approach to care through the Frimley Integrated System has been some of the relationships that I've formed with other people from very different healthcare backgrounds. So, for example, having much more of a personal relationship with mental health practitioners means that if I'm in a challenging situation, such as, with difficult patients at home or the care home that I look after with 100 residents, I have easy access to a mental health practitioner and a route into the mental health service. And without the integrated care system, I wouldn't have had that personal contact.
We've had a really good response from the team. Very positive response and feedback from patients and their relatives. And for me, I think the most useful thing is being able to refer to a group of really truly holistic professionals who put the patient at the centre of the issue. So they look at the patient's problem from the patient's point of view, and everyone that's needed is virtually around the table.
One of the main benefits of integrated care is the support given to carers and families who are looking after their loved ones, as Pam tells us.
I started caring for my mum in 2015 and she was formally diagnosed with semantic dementia in 2017. It's very difficult. With dementia, you also obviously have some elderly age-related issues as well. And there are lots of groups that you end up having to deal with. You've probably got the older person's mental health group, the district nurses, the psychiatric community teams, the incontinence teams, your local GP. So it's very easy to find yourself in the cracks in between these service teams, and you don't really know where to go to get the help. Last year her dementia declined very rapidly, very quickly. I found myself in a really emergency situation on how to cope. That's when I was referred to the Integrated Care Services team, and that's when things started to happen.
What we find is people aren't bouncing around from one specialty to another, or from one professional to another. And obviously the satisfaction for people is that they possibly only need to tell their story once, and then they get supported with a range of solutions, and then they come out of that in a better place.
Over the past 12 months, the 3 locality access points across East Berkshire have received and discussed over 2,500 referrals. Having an approach where social care and health partners work so closely together has helped support over 96% to remain at home and avoid a hospital admission. Providing direct access to this quick and coordinated response is helping hundreds of people with complex needs to stay in the community, supporting their families and carers to continue with their care and link in with other vital professional support.
In the future, I think integrated care will move on. I think more disciplines will want to come and be part of it. It's made life easier for me as a practicing GP to have somewhere that I know that will pick up the patient and have a look, whatever the problem is.
I think integrated care feels like a very positive step going forward, and certainly the correct approach to how we try to manage patients more in the future. Rather than having these siloed clinicians and people in different specialties and areas and different facets of care, trying to provide individual care for patients by aligning it all together, linking it up, is far more holistic, and I think ultimately will no doubt benefit the patients.
All of this has been because we've taken brave steps to be able to work together. And I think in terms of those brave steps, we've been supported by the Better Care Fund. And the Better Care Fund is where we can, with the local authority and with the NHS, think about doing things in a different way. And this integrated care decision making, if you like, is that different way of thinking.
I won't be alone. There's probably a huge number of families out there who are struggling to find their way around the system and to gain access to the advice and the care that they need for their loved ones. So an integrated care team that can bridge the gaps between these services must be essential to these families.